The overall goal of this video is to describe a simplified workflow for microRNA analyses in archived prostate cancer clinical specimens using a combination of quantitative real-time PCR and in situ hybridization with the implementation of locked nucleic acid-based probes. This is achieved by first isolating tissue from prostate cancer FFPE sections using laser capture microdissection, followed by a microRNA extraction. Next, two-step RT-PCR is used to quantify the microRNA in the tissue, and to localize the microRNA, in situ hybridization analysis is performed using digoxygenin-labeled LNA probes and AP-conjugated anti-digoxygenin antibody detected by BM-Purple. The presented results show expression of a microRNA in prostate cancer clinical tissues using these techniques.
Recently, microRNAs have emerged as promising alternate disease biomarkers for prostate cancer. However, microRNA expression analysis in prostate cancer clinical specimens is often challenging owing to confounding factors like heterogeneity of prostate tumors and factors like stromal contamination.
We have been working in the field of microRNA and non-coding RNA for the last 10 years. We have optimized the condition for microRNA expression in different stages and grade of prostate cancer. We believe that microRNA expression can be used as a diagnostic and prognostic biomarker because it correlates with the clinical outcome of prostate cancer. We also believe that microRNA can be used for treatment of prostate cancer using nanoparticle technology.
Accurate expression profiling in prostate carcinoma is often hindered by heterogeneity of the lesions. This is partly overcome by